Welcome to Adapt English Practice Question 85 questions. This is test number 20. This is the hardest of all. This is a mock simulation, like a CAT exams, random questions. If you score over 65 questions, you're on your way passing. It's based on the distribution of the rare NCLEX. Stick around, get a pen and paper, keep track of your record, but let this test number 20 be your mark to pass the NCLEX. Let's get to it. Are you ready? Let's go. Number 1, prioritization. After administering pain medication for each client, which client the nurse should see first? Who I need to see first? A client who has what? Post-external fixation device 6 hours ago to the left leg. Do you need to see them after the pain medication? A client who is post-expiratory laparotomy 6 hours ago. A client who has chronic radiculopathy admitted 6 hours ago. A client who's experiencing vaso-occlusive crisis admitted 6 hours ago. Who do you want to see? Stop the video, pick your answer, and let me know. Keep track of your record. But I can tell you, D is the right answer because this patient will have progression of their symptoms. All other patients may be taken care of. Sickle cell patient is the one who is in trouble. Why? Because the disease may progress. If you have back pain, I give you pain medication. Yes, I can see you, but that's not a major problem. If you have respiratory laparotomy, I may see you, but that's not a major problem. If you have X-fist plate, I may see you, but that's not a major problem. I expect vaso-occlusive disease to progress. Therefore, that patient we need to see. And this is performing assessment of a client. And this is performing assessment of a heart of an adult client. Identify the area where the nurse will place the stethoscope to auscultate the heart sound heard in the tricuspid area. Which area is the tricuspid? 1, 2, 3, 4, 5. What do you think? Which one are you worried about? A is the aortic valve. P is the pulmonic valve. E is the Erb's point. T is the tricuspid. And 5 is what? Mitral valve. Therefore, number 4 is your right answer. NS is assessing a child in emergency department suspected to have severe lead toxicity. Which action the nurse should prioritize? Give them activated charcoal, insert NG tube, chelating agent, give them calcium gluconate. What do you think? Keyword, lead toxicity. How do you take care of lead? Remove it from the system. How do you remove it from the system? Chelating agent. Therefore, which one you want to use? Not activate the charcoal, not insertion of NG tube. They're going to vomit. Don't pick calcium gluconate. That's a trap. You give them a chelating agent, which is what? EDTA. That's what you give them. That's the key. And this is at the outpatient clinic is assessing the following client. Which client situation warrant immediate intervention? Select and apply. This is a pharmacology. Look at the situation. Which combination should worry you? Divide it into tetracycline for acne, and you have pregnancy test that is positive. Reporting orange urine after taking what? Phenoxyparadine for UTI. Close angle glaucoma, you're taking dicyclomine for irritable bowel syndrome. Hypothyroidism, you're taking levothyroxine and you're taking antacid 30 minutes after taking the medication. Metronidazole for UTI and your blood alcohol level is elevated. And your iron deficiency anemia, taking iron supplement and you're taking it with milk. The situation requires immediate intervention. What do you think? Tetracycline is what? Teratogenic. If you're pregnant, stop it. Phenoxyparadine will turn your urine into what? Orange, expected finding. Close angle glaucoma, dicyclomine will cause what? Worsening of your glaucoma. Hypothyroidism, taking levothyroxine, no antacid. Metronidazole, no alcohol. Iron deficiency anemia, take it with what? Orange juice, not milk. Those are your right answer. Next Generation NCLEX. Same strategy. Read the question. Don't worry about it. Find the buzzword in the first 2 sentences. Make your diagnosis and use it to answer every question they've given you. That's all. Use it to answer every question they've given you. That's what you're going to pay attention to. That's all. 9-year-old, difficulty breathing. Client brought to the emergency department by the parent. Client reports shortness of breath. Appear agitated but alert oriented. audible wheezing throughout respiration, using accessory muscle with the visible chest retraction, non-productive cough. Those are the vitals. So rented times 3, but he has what? Expiratory wheezing throughout lung fields. There's no stridor, there's no hoarseness. That tells you that's asthma, right? S1, S2. With mild tachycardia, abdomen non-tender, non-distended. He has eczema over the elbow. He takes albuterol and fluticasone, right? And peak flow is 50 to 60. What do you think? Asthma exacerbation, classic asthma exacerbation. Therefore, what? Select for finding. The nurse immediately should follow up with peak flow, use of accessory muscle, appear agitated, audible wheezing, eczema on the elbow, and the history of asthma. Of course, peak flow is in a red zone. Using accessory muscle is bad. If you're agitated, it's bad. Respiratory distress. Audible wheezing, bad. Eczema and history of asthma, we cannot change it. Which of the following they then should expect if the client is experiencing foreign body aspiration? Foreign body aspiration is different from asthma. What do you expect in foreign body? That means your airway is being obstructed. Stridor, inspiratory wheezing, coughing, shortness of breath, hoarseness, expiratory wheezing. What do you think? I can tell you, you're going to have stridor, you have inspiratory wheezing, not expiratory. You have cough, shortness of breath, and hoarseness. Nothing about expiratory wheezing. Identify 2 conditions the client is at greatest risk. If you have asthma and you're having exacerbation, are you going to have respiratory arrest, cardiac arrest, stroke, heart failure, and sepsis? Based on your content, don't pick anything. Just think about it. What would you do? Respiratory arrest, cardiac arrest, because you have airway. You're not going to have stroke, heart failure, or sepsis. Which of the following intervention is indicated then? Do you establish IV for asthma patients in having exacerbation? Give them bronchodilator, do chest physiotherapy, give them fluid, initiate tripod position, give them oxygen, clear liquid diet, steroid via MDI and ipatropine. This is asthma exacerbation. You know it. When they put in the case form, it look like very complicated. But what do you do with the asthma exacerbation? Of course, they need an IV so that you can give them medication. Bronchodilator, through nebulizer. Chest physiotherapy is not cystic fibrosis. They need IV fluid for the dehydration. Keep them in the tripod position. Give them oxygen. They are not eating, no clear liquid diet. That's why you give them IV fluid. You give them steroid and a bronchodilator. This is what you do in an asthma position. Which order should the nurse give them? Which one should you do first? Bronchodilator, steroid, IV access, and tripod. This is always a trap. If somebody is having asthma exacerbation, open the airway. Bronchodilator is the best. You don't need an IV to give them bronchodilator. Now, this is the condition. After 1 hour of treatment, patient is receiving albuterol, ipatropine, steroid. He remains alert and oriented, but look at it. It's appear tired and calm. That's it. What? Silent. It's getting silent. There's no wheezing. That's silent chest. That's what? Status asthmaticus. We are in trouble. Intercostal muscle retraction is present. What are we having? We're getting into trouble and we got to do something about it. Heart rate is 125, respiratory rate of 30, saturation of 89 on face man. This patient is not doing well. What is the treatment of status asthmaticus? Magnesium, BiPAP, epinephrine, intubation, assessing for hyperinflation of the X-ray, and giving them oxygen mixed with helium to open the airway. This is a classic status asthmaticus question. But I want you to know, if you don't know, you have to give them magnesium. They may need a BiPAP to keep them giving phosphor oxygen, epinephrine to take care of allergy associated. You may eventually have to intubate them. You got to get an X-ray to make sure there is no too much trapping of air. And they may need oxygen mixed with helium to open the airway. This is the treatment of what? Status asthmaticus. How did you do? I know you did well. Let's continue. This is prioritization, but you got to arrange them. And this is aware of 5 clients. Arrange them in the order of priority. Somebody with a CHF and pink fluid sputum. Somebody with a right knee Pain, 9 out of 10. Somebody who's wheezing after avocado. Somebody who has a blood pressure of 180/90, and somebody who has Kalen sign. Based on what you have, think about who you need to see first and arrange them in order. But I can tell you who's number one. Think about it. Whose situation is worse? If you're wheezing after avocado, airway problem. If you have CHF and pink fluid sputum, that's what? Breathing issue. If you have current sign, that means you're bleeding. And then hypertensive urgency is number 4, and then knee pain, number 5. This is the way you arrange them. Is that the way what you got? Like I said, stop the video, answer the question on your own. Now, this is another next generation question, but you know the way he's put it is the way to track you. But it's the same thing. And let's care for a client receiving enteral bolus feed. What do you do when somebody has bolus feeding? What's your strategy? Which one is indicated or not? Place the client in the semi-power position. Is he indicated? Flush the tube with 30 ml of fluid before you feed them. And discard the residue if it's greater than 100. And begin feeding them if the residue is less than 200. And confirm tube placement if you do gastric pH and it's less than 5.5. I can tell you, power position is indicated to prevent them from aspirating. You need to flush the tube with 30 cc. That's adequate. You should not discard residue if it's greater than 100. Give it to the patient, not to indicate it. If the residue is less than 200, does not mean you should feed them. You have to assess for symptoms. Are they bloated? So it's not indicated. And if you get a gastric pH of 5.5, no need to confirmation. It's in the right place. You don't do that. This is what you do. As usual, watch the video multiple times and master the content, write the content that I'm giving you. Now, and this is assessing a client in the emergency department concerned about being pregnant. Her last menstrual period is 6 weeks. She's crying about having missed a period. Which of the following symptoms is indicated of probable, presumptive, and possible? You already know. Probable, presumptive, or possible pregnancy or positive pregnancy. You know them, all right? All these things is just put in this situation. What do you think? What do you think? Breast enlargement, positive beta ACG, bluish coloration of the vagina, fetal eye tone, compressible lower uterus, intrauterine fetus, nausea and vomiting. What do you think? I can tell you, B is what? Now, breast enlargement is a presumptive. If you have positive pregnancy test, that's what? Probable. Bluish discoloration is also what? Probable. If I can hear a fetal tone A, this is a positive pregnancy. If they can compress the lower uterus, these are our probable signs. And if there's a baby inside you, positive. If you have nausea, this is what? Presumptive. This is what you should expect. This is the way they will give you the question. It does not matter which table they give you. The way they present it is the same concept. It does not matter. So that's the concept there. And then she's teaching a client about upcoming what? Electroencephalogram. Which statement indicate the client understand the instruction? EEG means I'm taking picture of your head. It's like an X-ray. Okay? You're checking if you're having seizures. We know doing anything. As you know, eat anything for 12 hours before the test. Well, what do you think? I need to wash my hair the night before the test and avoid styling product. I will need to take a sedative before the test to relax. I cannot have caffeine for 24 hours after the test. What do you think? EEG, we just come in, we just put electrode in your head and then monitor you. That's all. You can eat before the test. The only thing is you can't put anything in your head so that the probe cannot stick. You're not going to give you any sedation. We're just watching you. I cannot have caffeine for 24 hours after the test. You can have caffeine. That's all. Let's discuss the lab results, finding with the client, and provide education regarding the results. Which of the following statement by the nurse is appropriate? This is what we have. Client at the maternal health clinic presumed to be what? Pregnant based on the evaluation at last visit. Client report nausea, vomiting, breast enlargement. Client was seen last week and here to discuss the lab results. Last menstrual period 4 weeks ago, on multivitamins, no vaginal bleeding. In monogamous relationship, does not use birth control. One therapeutic abortion in the past. What is the problem? The beta ECG 2 days ago was what? 40. 4 days ago was 82. 6 days ago was 162. That means it's going up. You see, beta ECG is going up. What do you think is going on? The beta ECG has doubled every 2 days as expected. You are pregnant. Your beta ECG rate of increase indicates molar pregnancy. The results indicate an healthy pregnancy. The results indicate ectopic pregnancy. Look at it. 2 days it was 40. 4 days it was 82. 6 days it was 120. Is the rate okay? 40, 82, and 162. Is that okay? That's the key. 40, 82, 162 in every 2 days. Is that okay? That's the concept here. You got to know this. They double every 2 days expected, right? That indicates you pregnant. The beta ECG rate increase indicate molar pregnancy. No, molar pregnancy will be in thousands. The results indicate healthy pregnancy because it's double. It's supposed to double every 2 days. So that it doesn't indicate a topic. It may go down. So that's the right answer. Master them, know this concept about beta ECG. And this is assessing a client at the maternal health clinic. The healthcare provider prescribed iron supplement. The nurse has provided medication teaching to the client. Which statement by the client indicate the need for further teaching? This is what we have. It's G1, 10 weeks old. Patient presents with ongoing fatigue, dizziness when upright. Client is here for treatment plan and lab work. Ultrasound confirms single fetus. This is what we have. There's a mucous membrane pill, S1, S2, and iron deficiency you can see based on the lab. Hemoglobin of T 10 and a hematocrit of 25. And a ferritin level is very low. What do you tell the patient? I will increase my dietary intake of cereal or whole grain. I will increase my dietary intake of liver or organ meat. I will increase my dietary intake of dark leafy vegetables or legumes. I will take the medication with a glass of milk or tea. I will take the medication with a glass of orange juice. I will drink a lot of water to prevent constipation. I will call my healthcare provider if my stool is dark. This is about iron and how to teach the patient how to take iron. That's all. And the question say, which one need further intervention? I will increase my dietary intake of cereal and whole grain. That's what? Excellent. You don't need to intervene. I will increase my dietary intake of liver and organ meat. What do you think? Also has a lot of iron in it. I will increase my dietary intake of dark leafy vegetables and legumes. That is excellent. Iron rich. I will take the medication with a glass of milk. You should not take it with a glass of milk. I will take the medication with a glass of orange juice. Excellent teaching there. I will drink a lot of water to prevent constipation. Iron causes constipation. I will call my healthcare provider if my stool is dark. It's an unexpected finding. You don't need to call me. The question says, which one need further intervention? This iron teaching need further intervention. A client with peptic ulcer disease is receiving education on dietary management. Match each food item with the appropriate recommendation. So you have peptic ulcer disease. Which of these teaching is expected or you should avoid, you should consume, you should encourage them? Caffeine, acid, spicy food. They should avoid or encourage or consume in moderation. Low-fat yogurt, milk, cheese. This is oat, brown rice, whole grain. What do you think? Of course, they should avoid acid food. Acid food is bad for peptic ulcer disease. And the low-fat yogurt, milk, and cheese, they can consume it in moderation. But most of the things you should teach them to eat is what? Oat, brown rice, whole wheat bread is encouraged. That's what you do. Like I said, these questions are hard, but it's designed to master this content so that you ace your exams. And this is caring for a client in the ICU who is having alcohol withdrawal. Which of the following intervention the nurse should implement now? This is the patient. Client was admitted for what? Alcohol withdrawal. It feel like something is crawling on the skin. Diaphoretic tachycardia. Bed in the lowest position. Is receiving what? Prodiposide per CWA protocol. Client has received a total of 45 of the prodiposide based on protocol. Client what? Unresponsive to voice at 9:20. This is with the vitals, tachy, heart rate is going down, respiratory rate is going down, blood pressure is going down. What is going on with this patient? This is alcohol withdrawal, and as we treat the patient, this is what is going on after we give them all the sedation. This is a benzodiazepine, and you have heart rate going down, respiratory rate going down, blood pressure, saturation going down. What do you want to do? Activate the rapid response team, initiate oxygen, place the client in semi-fowler position, administer naloxone, notify the healthcare provider, administer flumazenil. Think about the question. Patient has alcohol withdrawal. We're monitoring them. We're following the CWA protocol. In the CWA protocol, you got to use this benzo medication to titrate it based on their condition. 9:20, this is what you have. The patient is unresponsive, is bradycardic, respiratory is going down, blood pressure is going down, saturation is going down. What do you think? That's all. Patient is having issue with what? Benzodiazepine. Therefore, what do? Activate the rapid response. You will need oxygen therapy. You place the client in the semi-fowler position. We're not going to give them naloxone. Naloxone is used for what? Opiate. We do not give them opiate. You need to let the provider know and give them flumazenil for the what? Flumazenil for the benzos. This is the way you answer this question. Pay attention to the keyword. Don't get trapped. Don't pick naloxone. So that's what you do. Patients having symptoms of overdose of benzos. And this is teaching a client with newly diagnosed with hypothyroidism about symptoms management. Which instructions should the nurse include? Select or apply. Take your medication on an empty stomach. Avoid exposure to cold temperature. Consume diet high in iron. Expect iodine. Expect a rapid movement in symptoms within a week. Report symptoms of excessive fatigue to your provider. This is hypothyroidism. What kind of signs and symptoms do you teach them? You should pay attention to. You should take your medication empty stomach. That's levothyroxine. You should avoid cold exposure because that's what hypothyroidism is. You can't tolerate cold exposure. If you consume food high in what? Iodine, it's not going to work. Expect a rapid improvement in your symptoms within a week. It does not. If you have excessive fatigue, you should let the provider know because you're having what? Hypothyroidism, severe hypothyroidism. You're going to what? Mesothelioma coma. This is what you tell the provider. Another next generation. A client with diagnosis with myocardial infarction 24 hours ago and admitted with what? For observation. So he has a heart attack. The client is now reporting shortness of breath, fatigue, swelling in the leg. If you have a heart attack and all of a sudden you're showing all these signs, fatigue, swelling in the leg, and then shortness of breath, this look like what? Is this pericarditis? Is it heart failure? Is it pulmonary edema or arrhythmia? Think about it. Heart attack. Nothing is pumping. Now blood is pulling up. Now you have shortness of breath, fatigue, swelling in the lower leg. What do you think? Fluid is building up. What do you think has happened to this patient? Of course, this is heart failure. This is not pulmonary edema. The pulmonary edema is secondary problem, but the main issue is you have an MI, now you have a heart failure leading to signs and symptoms of pulmonary edema. What two things you would do? This is a multi question. What two things you want to do now? Administer prescribed diuretic, position the client in the semi-fowler position, give them oxygen, monitor their cardiac rhythm. What is the most prioritized information you want to do? Of course, give them what? Diuretic, and then they will need the oxygen. It's better than the position you're going to put them. Give them oxygen because they rather want oxygen. They're having symptoms now. It's better to give them oxygen. What are you going to monitor for? After you give them oxygen and fluid, Management is very important so that you know you don't go fluid retention. And then you monitor their oxygen saturation regularly. You don't worry about bleeding issue. And you don't worry about what? The neurological. This is another stroke patient. So those are the questions, information you want to know about this patient. And let's care for a client with what? No schizophrenia in the mental health unit. What do you think? Which of the following the nurse should recognize as a positive signs and symptoms? This is what you have. Client is alert, oriented ×3, withdrawn, flat affect, no appetite. He threw breakfast to the nurses in the garbage. Disheveled, poverty of speech, disorganized thought process, affect is still flat, reporting hearing voices telling him not to what? Eat lunch, feel like the nurses are trying to poison him. He lacked motivation to do something. He has been sitting on the floor all day with odd posture. Emotional ambivalent. He's socially withdrawn. He's not talking to anyone. Thought still disorganized and not logic. Which of these indicate that this is what? Positive symptoms. Poverty speech, disorganized thought process, flat affect, hallucination, nurses planning to poison him, lack of motivation, odd posture. Positive symptoms and the symptoms we used to diagnose. That means you're adding things to whatever is going on. Addition, right? If I'm adding things to things, what do you think? Poverty of speech, I'm subtracting, right? Disorganized thought, I'm adding. Flat affect, I'm subtracting. Hallucination, I'm adding things. Nurses planning to poison me, I'm coming up with things, I'm adding. Lack of motivation, I'm subtracting. Those are negative. Odd posture, negative. So this is the way you can remember positive and negative symptoms. 17. A client is scheduled for colonoscopy. Which pre-procedure instruction is most important for the nurse to provide? Colonoscopy, I got to look inside your colon. It has to be clean. What do you tell them? Do not eat or drink after midnight. Take a laxative the night before. You may have breakfast the day of the procedure. Drink clear liquid until the procedure starts. Like I said, the most important, clean yourself. The most important, clean yourself. Therefore, which pre-procedure instruction is most important to provide? Do not eat or drink anything. Take a laxative the night before. Drink, you may have breakfast the day of the procedure. Drink clear liquid until the procedure starts. What do you think? The most important is to clean yourself. Therefore, I will take your laxative the night before so that we can clean ourselves. And this is assessing a client in the mental health clinic. Which finding require follow-up? What is the problem? He's a new client. He's unkept. He has poor eye contact. Something is wrong. He dressed disheveled. Client is broken up with the boyfriend 3 months ago. They dated for 6 hours. Report insomnia, loss of appetite, weight gain. You know what is going on. This is mental health. I make these questions very hard so that you can think. You read a lot and you get confused. But this is mental health. Hopelessness, feel sad, with depressed mood most of the day. Is this patient depressed or adjustment disorder? I stopped jogging and writing journal. A favorite activity to pass time, she stopped doing that due to inability to concentrate. Very irritable. Client said, I don't think I can go on anymore. Those are the vitals. No medical history. This is what is going on. Which of this require follow-up? That's all. Poor concentration, hopelessness, irritability. I can't go on any longer. Feeling sad and depressed mood of the day. Broke up with the boyfriend. Of course, poor concentration, hopelessness are bad. And irritability, psychomotor agitation. I can't go any longer. That's number one. And of course, feeling sad. These are all diagnoses of what? Depression. If you broke up with your boyfriend, that's not a major problem. We don't care right now. A nurse is caring for a client with left leg wound infected with MRSA. Which nurse action is appropriate? Wear a single-use gown and face shield when interacting with the client. Remove gown outside the client's room after care. Ensure all dressing supply are in the client's room. Don gown and gloves during dressing change. Patient has MRSA. What do you think? Patient has MRSA. What do you think? What are you going to do? Which function is the most important? When you're interacting with the patient, you don't need a face shield. You can use gown and gloves, but face shield is when you change the dressing. You don't remove your gown outside. That's a problem. All dressing supply are kept in the client's room. What do you think? You got to dress before you get there. So if you keep everything there, what do you think? Don gown and gloves during dressing change. You should wear something in your face. Therefore, all dressing supply are in the client's room because you cannot leave the room and then go find them again. So keep all the dressing supply in the client's room. And this is expecting 4 clients to the ward. Which client the nurse should assign to the room closest to the nursing station? Somebody who has problem, who is going to fall. The client with the weight loss, fatigue, night sweat, positive tuberculosis test. A client who is oriented to only person after a new UTI infection. A client who has 9 out of 10 severe migraine headache. A client who has AFib require continuous cardiac monitoring. Who should be at the nursing station? What do you think? If you have weight loss, fatigue, night sweat, positive PPD, you don't need to be a nursing station, right? We don't need to monitor you. Client who is oriented to person only one and UTI, sepsis, is going to get up and then go everywhere. We should need to monitor you. A client who has severe headache does not need to be near the nursing station. A client who has AFib requiring continuous cardiac monitoring does not need to be in nursing station. 1700. A nurse care for a client with tib fracture after a soccer. Those are his vitals. He has pain 2 out of 10. His left leg, tib fracture, immobilized. Capillary refill, 3 seconds. Client move all toes, feet. Is warm. The solid pedis is +2. That's 1700. At 1900, client report the pain is now 8 out of 10. It's still tachycardia. Saturation is okay. You require more medication every 20 minutes. His capillary refill stay less than 3 seconds. He's unable to move his toe. The solid pedis is now +2. Which finding at 1900 do you think require priority? Requiring pain every 20 minutes. The solid pedis pulses is now +2. What was it before? Is +2. Pain is 8 out of 10. Is unable to move his toe. Saturation, what is the problem? 99 on 2 liters. His saturation was 100% room air. That's not good. And his heart rate, what is his heart rate? 115. For what do you think is going on? Of course, requiring pain every 20 minutes, that's bad. His dorsal pedis pulses is normal. His pain 8 out of 10 has increased. He's not able to move his foot. That's a problem. And his heart rate is going down. And his heart rate is going up. That's a bad problem. That's what it means. Be getting ischemic, and that's a problem, tachycardia. And nurse care for a client who needs consent for surgery. Which of the following the nurse should prioritize? Observe and verify client signature, evaluate client understanding of the information provided about the procedure, explain the risks and benefits for the procedure, ensure the client is pain-free before the procedure. What do you think? Patient need consent. What should you prioritize? What is the most important thing for you? We don't care about observing and verifying. Make sure the patient understands the information provided. That is your job, is to witness it. Your witness is to understand that the patient also understands the information provided and they know what the procedure they're going to have. It does not have to do with risks and benefits of the procedure or the client is pain-free before the procedure. This is all you care about. You know why they're getting the surgery. You understand the risks and benefits, but all of them is understanding of the information provided, and that is the most important. And this is assessing a client with a new diagnosis of anorexia. Which of the following findings the nurse should expect and not expect in a client who has anorexia, BMI of 18.5, less than, hypothermia, denungo, tachycardia, monohagia, poor skin tear, impaired conjunctivitis. These are content. Like I said, this video is hard. I put all the things you think you should know, but in a different form, pictures, presentation, so that it can scare you. But no, you know what you do. Therefore, give it to me. BMI less than 18.5 expected in anorexia. Their temperature is going to be low, expected. They're going to have lenugo, expected. They're going to have what? Bradycardia, not tachycardia. They're going to have what? Less menses, so amenorrhea, no monohagia. That means they're going to have a lot of menses. No, not expected. Skin tear is going to be poor and a pale conjunctiva. That's what? Conjunctiva. That means what? That means what? Pale conjunctiva. That means what? Anemia. So this is what you expect in anorexic patient. And this is aware of a client with a BMI of 16, weight loss of 20 pounds over 2 months. That's bad. Who's yelling? I'm fat and ugly. Anorexic patient. Which intervention the nurse should prioritize in the plan of care? Recommend mental health clinic, assess client nutritional status, monitor client oral intake, and correct general writing. What should you prioritize in this situation? They lost 20 pounds over 2 months. They think they're fat. This is bad. The BMI of 16. Mental health consult. Physical need is the most important. Which one is the most important physical need? Nutritional status will tell you how bad is their physical need before you deal with your psychological need. So that's your right answer. And this is in emergency. Is aware of what? 4 clients. Which client the nurse should prioritize? A client with depression who was found with an empty bottle of imipramine. That's TCA. What do you think? Overdose. Client with this DVT on warfarin who fell and hit his head. The GCS is 15, right? Client with urine urgency, frequency, and burning for the past 6 hours. UTI. Client with copious amount of fluid nasal discharge, cough, and temperature of 101.5. Pneumonia. Who is in trouble? Somebody who overdose. We got to see them. Bad problem. And let's provide care for a client admitted for pneumonia. It was alert-oriented in the morning. The client is now confused. Alert-oriented in the morning, now confused. What should the nurse expect? Delirium, depression, dementia, stroke. Acute change in mental status is what? No stroke, no dementia, no depression, delirium. A client with liver cirrhosis experiencing signs of what? Hepatic encephalopathy. Which of the following the nurse should anticipate in the plan of care? Deal with the encephalopathy. Give the lactulose, monitor mental status frequently, monitor ammonium, titrate lactulose to 4 to 5 bar movement, monitor for flappy tremor. What do you think? Lactulose will help with what? Encephalopathy. Mental status has to be monitored. We should check ammonium. Titrate what? Lactulose to 2 to 3 bar movement and check for flapping tremor. That's hysteresis. Very, very important. Another case, and let's care for a client in the emergency room. What do you have? Client present to the emergency room unresponsive. The stranger found the client on the street suspected of experiencing what? Opiate overdose. Unable to obtain history. What is the problem? Heart rate of 80, respiratory of low, right? Opiate overdose. What is the problem? Blood pressure is low, saturation is 93, patient is difficult to arouse, GCS of 15, lung with decreased breath sound at basis, there's a palpable cardiac pulse. What's the problem? Patient CBC shows WBC of 11, platelet is normal, glucose is 140, all the lab work in the BMP, you can see pretty much blood potassium is elevated 6.1, ABG, pH of 7.1, and it's PCO2 62, respiratory acidosis due to probably overdose of opiate. And we have all these lab work, ABG. Put it together. This is not that difficult if you think about it. You know it's opioid overdose. All these symptoms is consistent with opioid overdose. Just figure out what they're asking you. Which of the following is concerning? Select and apply. That's all. Which one is concerning? pH potassium 6.1 is not good. GCS of 12, nobody want to be in that GCS. pH of 7.1, bad acidosis. PCO of 62, this is what? Respiratory acidosis. Sodium of 140 is normal, and all responsiveness, they are all bad. The next note that the client most likely experiencing what? Cardiogenic shock, respiratory depression, myocardial infarct, and pneumonia. If you have opioid overdose, it's going to be respiratory depression. What is the acid-base interpretation? pH of 7.1, CO2 of 65, and bicarb of 26. Stop the video, answer it on your own. I know I'm answering them, but I know you've been stopping them, answering yourself to keep track. I want you to get 65. They are hard, but I know you got it. This is a very important video I want you to watch because of the way the question, all kind of question, different ways is that they keep on coming left and right. You don't know which one is coming. This is what the NCLEX will do to you. Be prepared for them and learn them. What do you think? What do you think? We have an acidosis. This is not something you should forget. And we have a CO2 of 65. Bicarb is 26. It has not changed. Therefore, it has to be uncompensated respiratory acidosis. It cannot be fully compensated. pH is still 7.1. It cannot be metabolic acidosis. Bicarb is that. This is a straightforward acid-base status. Which of the following the nurse should anticipate in the plan of care? Overdose of opiate, CT scan, chest X-ray, naloxone, flumaxinil, frequent neurological exams. When you see this kind of question, there's going to be trap. The GCS is low. We got to figure out what is going on in your head. We got to listen to your lung. Make sure you don't have aspiration. Opiate, get naloxone. But there's no flumaxinil because that's no benzos and frequent neurological exams. At 10 o'clock, the in-charge nurse is reviewing the primary nurse for a break 1 hour after the chest tube placement. So we place the chest tube. Which of the following finding will cause the charge nurse to intervene 1 hour after chest tube? So based on the patient, he requires a chest tube, and we place the chest tube. After administering the naloxone, the client is now alert oriented to times 15. Report using fentanyl-laced drug and falling on the street. Family member is at the bedside. This is what we have. Chest X-ray show left-sided pneumothorax. A left chest tube is placed. Now we place the chest tube. Which one should you worry about? A small intermittent bubbling in the air leak chamber. That's what. Should you worry about it? That's an expected finding. It's not something you should worry about. Blood tank fluid in the collecting chamber. Something you should worry about it. Expected finding. Pleural vac is taped to the ground. Yes, somebody was going to kick it. There is no observable fluid fluctuation in the chest tube with client expiration. That means there's no tidling. We should worry about it. Ingestion site is covered with occlusive dressing. That's good. Continuous bubbling in presence in the suction chamber. In the suction chamber, you should expect continuous bubbling. Expected finding. So that one, we are not worried about it. 48 hours later, the chest tube was removed after confirmation, no air leak, and chest X-ray showed no pneumothorax. However, the clients continue to require 2 liters of oxygen to maintain oxygen saturation on 95. So when you remove the chest tube, it's still requiring oxygen. Therefore, it's going to go on with the oxygen. The physician prescribes oxygen therapy, and the nurse provides education on oxygen safety at home. What should you tell the patient? Which statement indicates ineffective teaching? That means they're saying something wrong. I will use oxygen in the well-ventilated area. Is that good? If you use oxygen, should you use it in a well-ventilated area? Effective teaching. I will cover the oxygen equipment to prevent overeating. Bad problem. Don't cover it. I will lubricate my nostrils with oil-based or petroleum-based product to prevent dryness. You will catch fire. I will post no smoking sign in the house. Excellent. I will avoid open flames like candle and gas near the oxygen tank. Excellent. I will change the oxygen tank at least every 7 days. Excellent. Those are key things you should provide for the patient. This is a hard one, but I know you got it. Go back to it. Know the content. We talk about oxygen. We talk about things you need to know about chest tube. And we talk about things you need to know when patient is having problem based on the content. How do you do? Question 29. A 35-year-old female is admitted to the hospital with signs and symptoms of UTI. Which symptoms reported by the client will be most concerning for the complicated UTI? There's different kind of UTI, but complicated UTI, you're talking about pyelonephritis and other things. Lower back pain, frequent urination, chronic pain with fever and chills, urine urgency. What do you think? 29. What do you think? Lower back pain, frequent urination, those are all not specific, but when you have frank pain and fever and chills, that's pyelonephritis. We worry about it. And this is educating a client on strategies to reduce what? The risk of what? Colon cancer. Which instructions should the nurse include? Increase fiber intake, avoid red meat, exercise regularly, screen colonoscopy at the age of 45, avoid straining. Which of this is indicated for preventing colon cancer? Fiber, make your stool much better. Red meat, avoid them. Exercise regularly, keep you regular, and screen yourself. 45 is much better. And this is educating a client with what? Neutropenia about precaution to prevent, reduce the risk of infection. Which of the following statement indicate incorrect understanding of neutropenic? That means ineffective teaching. If you have neutropenic and you are neutropenic precaution, I will avoid fresh flower in my room. I will have fruit and vegetables as long as they are washed thoroughly, but better to avoid it. I should avoid crowded places like malls and public transportation. I will wash my hands frequently with soap and water. I can receive routine vaccination without consulting my provider. Which one? 31. Which one indicate incorrect understanding of neutropenic? Of course, you cannot have vaccination without talking to your doctor. Washing your hands is much better. You should avoid crowds. You should have fruit and vegetable as long as it's what? It's totally wash it, and it's better to avoid it. It's better to avoid. I will avoid fresh flower in my room. All of this effective. The only thing that is ineffective is E. 1. Over selection, you mix all the points. And then she's teaching a group of clients about food safety to prevent food poisoning. Which statement indicate correct understanding? I will refrigerate leftover within 2 hours. Is that okay? It is safe to throw what? Raw meat on the countertop. I should wash fruit and vegetable before eating. Leftover should be reheated to at least 165 degrees Fahrenheit. I can eat raw eggs as long as they are fresh. Which one? This is food hygiene, nutrition. What do you think? I will refrigerate leftover within 2 hours. Correct. That's good. It is safe to thaw meat on the countertop. No, that's not good. I should wash fruit and vegetable before eating it. That's great. Leftover should be reheated to that temperature to kill all bacteria. A client is experiencing depression, expresses feeling worthless. What's the best response by the nurse? Why do you feel that way? Everyone has days that when they feel that way. You have many strengths and qualities. Tell me more about how you are feeling. You know the right answer. Always ask for more. A client with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor for? Furosemide, what do you think? Muscle cramp. Which electrolyte causes muscle cramp? Hypokalemia. And this is assessing a newborn reflexes. And this is assessing a newborn reflex. When the nurse strokes the sole of the baby's foot, the toes fan out. What reflex is this? Monroe reflex, Babinski reflex, routine reflex, grasp reflex. What is this one? This is classic Babinski reflex. And this is teaching a client with the wound infection about home care. Which instructions should the nurse include to prevent infection? Keep the wound covered with the sterile dressing. Change dressing only when soiled. Wash hands before, after wound care. Apply antibiotic ointment as prescribed. Avoid showering until the wound is fully healed. Which teaching is appropriate? Keep the wound covered with the sterile dressing. You shouldn't not change the dressing only when it's soiled. Change it all the time. And wash your hands after and before you do wound care. And then apply the antibiotic ointment given. You shouldn't avoid showering. You should shower. Showering is the best way to clean the wound. A 45-year-old client with a history of hypertension is admitted for chest pain. The client's blood pressure is admitted to 168/94. Bad, hypertensive urgency. They report the family history of what? Heart disease. Which medication should the nurse expect to administer first? What do you think? Hypertension, the family history of that. Which one would you give? Morphine, furosemide, nitro, and aspirin. Which one? This patient blood pressure is very high. He's having chest pain. The best medication that would deal with both is nitro. Nitro will be vasodilation and help with the chest pain. A 45-year-old client with the history of hypertension is admitted for chest pain. The client blood pressure is on admission is the same thing, 168/94, and they report family history of that. What is the next initial priority assessment? What are you going to do? Same patient, different scenario. You listen to their heart, you monitor their blood pressure, you get an EKG, or palpate the peripheral pulses. They reporting about chest pain, get an EKG. NS is preparing to administer digoxin to a client. Which finding will prompt the nurse to hold the medication and notify the provider? Bad problem. Heart rate of 50, potassium at 3.2, digoxin 1.5, client report nausea and vomit, anorexia. Which of this? Of course, apical heart rate is too low. Potassium is too low. Digoxin level is fine. Nausea and vomiting, GI symptoms, anorexia, GI symptoms, we're going to hold it. 1.5 is within normal range. Number 40, and this is educating a client with gastroesophageal reflux. Which instruction should the nurse include? Select or apply. Avoid eating right before bedtime, wear loose feeding, clothing, lay down after meal, limit caffeine and alcohol intake, eat smaller, more frequent meal. What do you think? What teaching do you provide? Gastroesophageal reflux. You should not eat before you go to bed right away. Loose feeding is better. Don't lay down after meal, limit caffeine intake, and eat smaller frequent meal. That's for the question. How do you do so far? What are your scores so far? And how are you doing? Keep track of your record. And at the end, I want to see you 865. During a routine prenatal visit, a client at 10 weeks gestation report nausea and vomiting. Which advice should the nurse give? What would you give? Drink milk every morning. Try eating small frequent meal. Avoid drinking fluid in the morning. Increase your intake of caffeinated beverages. This is what? Hyperemesis Gravidarum, but not vomiting. We are not in the second stage yet, but this is the beginning. So what do you teach the patient? Small frequent meal is much better. NS is assessing a client with the chest tube. Which finding will require immediate intervention? Intermittent bubbling in the water cell chamber. What do you think? Chest tube is client for ambulation. Continuous bubbling in the water cell chamber. The drainage collection as 30 ml. Which one require immediate intervention? Bad problem. Drainage collecting chamber of 30 is fine. Continuous bubbling in the water cell chamber, I don't like that. Chest tube is clamped for ambulating. Yeah, you can clamp it partially. Intermittent bubbling in the water cell. But test taking strategy, we have two water cell, and one is intermittent, one is continuous. I'm going to pick this. The client is grieving the recent loss of a spouse, expresses feeling of guilt and remorse. Which response by the nurse is most therapeutic? Ask for more. Your spouse shouldn't want you to feel this way. Many people feel this way after a loss. It sounds like you are feeling a lot of different emotions. I think you should try focusing on the positive memory. What is the best response? Therapeutic. The spiral wouldn't want you to feel that way. Wrong answer. Many people fail. I'm not many people. I think you try to focus on the positive. No, you sound like you're feeling a lot of different emotion. That's good. And they will ask you for more and they will talk. A client with UTI is receiving discharge instruction. Which instruction should the nurse include? Select and apply. Drink at least 8 glasses of water. Avoid taking antibiotic until symptoms improve. Urinate frequent to flush out your bacteria. Avoid bacteria, caffeine, and alcohol. Limit fluid intake to avoid frequent urination. What do you think? A lot of water. You shouldn't avoid antibiotic. Urinate frequently to flush yourself out. Avoid caffeine because they are irritant. You shouldn't limit fluid. 45. A client with asthma is being discharged. The nurse review the client action plan and medication instruction. Complete the following. Use the inhaler 15 minutes before what? Exercise to prevent exercise-induced bronchospasm, right? That's what you do. Monitor peak flow daily to prevent what? Prevent exercise-induced or monitor lung function or reduce chronic inflammation of the airway. Why do you monitor your peak flow? That's the key. Monitor your lung function for worsening symptoms. Take daily oral corticosteroid prescribed to do what? Help with the inflammation. So this is the way it's going to be. Multiple, select or apply. And this is teaching a client about factors that increase the risk of osteoporosis. Which risk factors should be included in the teaching? Select or apply. Sedentary lifestyle is a risk factor for osteoporosis. Caffeine is a risk factor. Calcium intake is much better, protective. Advanced age is a risk factor. Weight-bearing exercise is protective. So those are something about osteoporosis. And this is reinforcing teaching for a client with a new prescription of anticoagulant therapy. Which statement by the client indicate an understanding of the instructions. Select or apply. I will avoid using ROSA to prevent cut. I can take aspirin as long as it's low dose. I should report any unusual bruising or bleeding to the doctor. I should take my medication only when I feel like I need to. I will use a soft Bristol toothbrush. Which one is good understanding for anticoagulation? That's all. Stop the video, answer the question. But avoid what? Razor blade as much as possible. Use clippers. You cannot take aspirin. If you are bruising, let me know. You cannot take your medication if you feel like you need to. And soft Bristol toothbrush is best. And this is recovering from surgery. A client is recovering from surgery. Ask the nurse when they can begin to eat solid food again. What is the best nurse response? As soon as you feel ready, you may eat solid food. When you can tolerate liquid without nausea, we'll try solid food. Let's wait until you have bowel movement before starting solid food. We'll begin with solid food immediately to help you recover. What is the progression of what? Diet. It's when you finish clear liquid, full liquid, then you can try solid food. A client with peptic ulcer disease is prescribed omeprazole. This statement by the client indicates correct understanding of the medication. I should take this medication with meal. This medication reduces stomach acid production. Omeprazole will coat my stomach lining to protect it. I should avoid taking this medication with antacid. What is the function of omeprazole? It's a PPI, right? Proton pump inhibitor, which is a proton pump inhibitor. What does that mean? This medication reduces acid production. I should take the medication with meal. You should take it 30 minutes before meal. It does not coat the stomach lining. It's not sucralfate. It does not coat the stomach lining. It's not sucralfate. You should avoid taking the medication with antacid. You can take it, but not at the same time. Therefore, this is the right answer. Next Generation NCLEX. 16-year-old female is brought to the emergency department by the parent due to episode of syncope upon standing. She appeared drowsy and has known history of anorexia nervosa. The parent states constipation, decreased urine output, amenorrhea, general weakness. On assessment, he has poor skin turgor, the noodle, oriented to place, time, and space in situation. What is the problem? His weight is low, temperature is cold, bradycardia, all the signs and symptoms of anorexia nervosa. You should never be surprised. EKG shows signs and symptoms of anorexia, sinus bradycardia. This is something you should expect. And when you click on the lab work, all the things means they are orthostatic. Look at it and you can see it's anemia. Sometimes you see this and you say, what is the too much problem? I've not given you anything. I've just given you content related to anorexia and I put it in a case form. Anywhere you go, this is the same thing they will present it. Just take it, move with it, see what the question is saying. The nurse has reviewed the clinical data. The most specific condition the client is most experiencing is what? Dehydration, hypoglycemia, refeeding syndrome, and shock. That's all. What do you think is happening to this patient? What do you think is happening to them? What do you think is happening today? Is this shock? If it's shock, you're going to have tachycardia. Hypoglycemia, do you see any evidence of that? Look at the pulse, up and standing. When you're standing, you see orthostatic, tachycardia goes up. This patient is not in shock. They're having dehydration, signs of dehydration. And therefore, which two actions should the nurse take? We're going to give them potassium. The potassium is low, 3.1. And what we're going to give them? IV fluid. And after we give them IV fluid, we're going to monitor their urine output and electrolyte. This is a bold type question. Next generation. How did you do? How did you do for the question 50? Don't worry. If you mix them, don't worry. We are now in question 51. A client with indwelling urinary catheter is at risk of what? Infection. That's the buzzword. Which intervention should the nurse implement to reduce the risk? We want to do things to prevent the risk of infection because they have a catheter. Select or apply. What do? Maintain a closed draining system. Empty the drainage bag only when full. Ensure the catheter is secured to the thigh. Clean the urinary meanders daily. Keep the drainage bag below the bladder. What are the things you do to prevent infection? These are clinical skills, fundamentals you usually do. Bring it to this question, but don't bring anything that is not asked. What do you think? Of course, closed drainage system will prevent infection. You don't empty the bag only when it's full. When it's 3/3 full, you should do that. Ensure the catheter is secured to the thigh of the individual. Excellent. And then clean the urinary meanders daily. Very, very important. And keep the drainage bag below the level of the bladder so that it can drain. When you put it above the level of the bladder, it affects drainage. And therefore, 1A, C, D, and E are your right answer. You don't have to pick everything. Pick those that you're 100% confident. That's all. And this is caring for a client with the latest allergy. That's the buzzword. Which precaution should the nurse take to ensure the client's safety? That means anything that has latex allergy in it, you should take it away. Use vinyl or nitrile gloves instead of what? Latex allergy. Place the client in a negative pressure room. Use latex-free IV tubing and syringe. Encourage the client to wear a mask at all times. The key word is latex allergy. What do you think? You should avoid any latex gloves, right? Use vinyl and nitrile gloves instead of a latex gloves is much better. Place the client in negative pressure room still does not prevent latex allergy. Use latex-free IV tubing and syringe, but you may have a gloves. Therefore, that's the best answer choice. And this is providing education about dietary source of iron for a client with anemia. Know this. Stop this video. Pay attention to the keywords. These are questions NCLEX will ask you about anemia, and calcium is one of the things you should know. What are the food sources you should give to a patient? Which of the following foods should the nurse include in the teaching? Spinach, red meat, milk, fortified cereal, and apples. Which one are good source of iron? Spinach, green leafy vegetables. Very good. Red meat, higher source of iron. Milk, calcium. Fortified cereal, very good. Apple, nothing. So pay attention, know them. Key fact about iron-rich diet. And this is preparing to administer medication to a client with a heart failure. Which medication should the nurse question if prescribed for this client? That means which medication a heart failure patient should not take. That's all. Bring your content. Low dose metoprolol, ibuprofen, furosemide, digoxin, acetaminophen. What do you think? If you have heart failure, you can take metoprolol, low dose. If you have heart failure, you should avoid ibuprofen because you retain fluid. If you have heart failure, furosemide is good. If you have high failure, calcium channel blocker, what do you think? If you have heart failure, what do you think? Acetaminophen is okay. Calcium channel blocker can be used in certain situations for patients with a heart failure. But in certain situations, you should avoid. So it's 50-50. Which one you want to pick? I'll go with it. The thiazide can basically depress the heart. It's like a beta blocker, right? It slows down the heart. It can cause retention. It can cause fluid retention. So we should avoid it. A 55-year-old female client with no history of breast cancer should begin annual mammogram at what age, according to the standard screening recommendation. These are key things you have to know. Screening. If you have no family history of breast cancer and you are 55, when should you begin your screening? What age is the best? What do you think? What is the best age to do the screening? Best is 45. 35 is usually when you have somebody who have it, right? 50, it used to be too late. 60, too late. 40 is the standard. Initial screening. And this is preparing to assist with the lumbar puncture procedure on the pediatric client. Which position should the nurse assist the client to facilitate the procedure? What do you think? Lumbar puncture. You got to lay on your side. I got to go through the spine. What is the best position? Supine with the knees and bend. You can't be on your back while we have to go there. Sitting position, leaning forward, maybe. Lateral recombinant with knee drawn up and transverse position. Which one is the best one? Always on your side. Lateral recombinant with the knee bend. It's better. It flexes your back, make it like a C shape, and we can go there. These questions are very difficult, but I know you got them. A client is being discharged with instruction for managing their hypertension. Which statement by the client indicate the need for further teaching? How do you manage your hypertension? I will limit my salt intake to help lower my blood pressure. I will take my blood pressure medication every morning with breakfast. I can stop taking my medication once my blood pressure is normal. I will avoid smoking alcohol to help manage my blood pressure. Need further teaching? You should never stop taking your medication. You have hypertension. You take it for the rest of your life. The client is admitted to the emergency room with sepsis, right? Which of the following initial action are appropriate for the client care? Select and apply. Sepsis, maybe shock, whatever, infection. Manage the patient. Draw blood culture before antibiotic. Start broad spectrum antibiotic. Increase IV fluid to maintain blood pressure. Hold blood pressure medication until stabilized. And monitor temperature hourly. How do you manage a patient with sepsis? Forget about sepsis. Say, I have infection. How do I manage it? That's all. 58. What do you think? Of course, culture before antibiotic. And the antibiotic has to be broad spectrum until you figure out what is wrong with the patient. And then they need to fluid in order to prevent sepsis. You don't hold blood pressure medication until stabilized. That's not allowed. And then monitor temperature hourly. That's too frequent, right? You don't need to monitor temperature hourly. every 4 hours is appropriate. And this is assessing a client with type 1 diabetes experiencing symptoms of what? Hypoglycemia. Symptoms of hypoglycemia. Complete the following sentence. Administer what? 15 grams of glucose for what? Rapid glucose correction. Prevent recurrent. Confirm what? Administer 15 grams of glucose for what? Administer 15 grams of glucose for what? What are you going to do? Rapid glucose correction. Prevent recurrence, confirm resolution of hypoglycemia. What were you going to do? What is the first thing you do? Rapid correction. Test the blood glucose in 50 minutes to confirm resolution of your symptoms. And then monitor the symptoms for what? Recurrent. So that's what you do. 15 grams of glucose for rapid glucose correction. Reassess the blood glucose in 50 minutes to confirm resolution of the hypoglycemia. And then monitor for signs and symptoms of what? Recurrence. And next is planning care for a client with limited mobility. Which intervention should be included to prevent skin breakdown? Select and apply. Reposition the client every 2 hours. Massage bony prominence. Use moisture barrier cream. Keep linen recurrent-free. Elevate the head of the bed to 45 degrees continuously. What do you think is the best way to do that? Of course, we're going to reposition the patient. We're not going to massage the bony prominence. We're going to use barrier cream, which is good. And recurrent-free is very good because it prevents the skin breakdown. Elevate the head of the bed to 45 degrees continuously. No, not every time. That's the key. Next generation NCLEX. This is the last next generation NCLEX question. What do you think? Client is in emergency room brought in by a caretaker. Client has made for 2 scheduled dialysis appointment. Keyword, dialysis appointment. That means renal failure. Caretaker reported client is confused, complaining about shortness of breath, probably retaining fluid, itchy skin, and muscle cramp, right? Because of probably Hyperkalemia. I'm showing you things you have to pay attention to. Itchy skin is due to what? BUN is increased. Uremia, right? All these things very, very important. Had flu-like symptoms recently and has been strong enough, have not been strong enough to go for dialysis. You're getting sick. Client lives alone in assisted living. These are the vitals: tachycardia, saturation 90 on 2 liters. Patients are alert or rented to person only. It smells like ammonia, right? It causes breath sound, lung, abdomen is distended, bowel sound present. He has 3 edema because he has not had +3 edema because no dialysis. And the capillary rate flow is less than, 3 seconds. Fluid overloaded. His skin is dry. He has chronic kidney disease. These are his lab. Sodium 135, potassium 6.2, creatinine 9.5. GFR is very, very low. Hemoglobin anemic, consistent with what? Chronic kidney disease. His platelet is normal. You take lisinopril. I try to summarize all the things so that you know that these are consistent with somebody with a renal failure. Therefore, what do you think? Which of the following finding is concerning? Based on what I've given you, which one is concerning? Think about it. His vitals are not good. The level of consciousness is not good. His lung sound, I don't like it. His heart sound was normal. If you look at his heart sound, it's very normal. S1, S2 is noted, but his labs are abnormal. Those are the ones we worry about. The next, note that the client is at risk of which of the following? Because of hyperkalemia, you're going to have cardiac arrhythmia. You're going to have uremic encephalopathy. That's why it smells like ammonia. He's fluid overloaded. He's on acute renal failure, and he has pulmonary edema. These are all consistent with this condition. Which of the following the nurse should anticipate in the plan of care? Based on what we know, what are you going to do? What are you going to do? Based on what we know. We're going to call nephrology, low potassium diet, obtain peripheral IV temporary, and a cardiac monitoring because of hyperkalemia. We got to get the EKG. You prepare them for dialysis, and he may need some blood. All this is indicated. But I've given you all the content that you need to know associated with this condition. The nurse received the following order. Which order should the nurse perform first? Potassium low potassium sodium diet, cardiac monitoring, give them blood, IV access. What do you think? Potassium is high. If the potassium is high, 6.2, we got to protect them. Cardiac monitoring, so that we can figure out if they're having signs and symptoms associated with it. Very, very important. So that's what we do. It's much better than doing anything else that is not needed. Cardiac monitoring. Which of the following should the nurse perform before starting dialysis? Check for any signs of infection at the dialysis site. Verify the patient's most recent potassium level. Assess the client's weight to evaluate fluid status. Administer prescribed antihypertensive. Obtain a recent chest X-ray to assess for pulmonary edema. What do we do before you send this patient for dialysis? What do you think? What is the most important? Of course, signs of infection at the dialysis site. And make sure we know the patient potassium level. And then assess the patient weight to evaluate it. You don't administer antihypertensive, they're going to get hypotensive during the dialysis. And obtaining recent chest X-ray to assess pulmonary edema, there's no need at this point. The client is undergoing dialysis. Suddenly, what happened? He became hypotensive, he felt dizzy, tachycardia halfway through this section. The nurse noticed that the client is becoming restless and pale. The dialysis machine has been functioning normally, and no issues has been noted with the access site. These are signs and symptoms when you're getting dialysis for the first time. This is what happened. Which of the following is the most likely cause of the patient's symptoms? Remember, yeah, I'm going dialysis, hypotension, dizziness, tachycardia. What do you think? Is this hypovolemia due to excessive fluid removal? The nurse should reduce the rate of the fluid removal and give them what? Normal saline. Is this the air embolism? The nurse should climb the dialysis tube and notify the physician. Is this hyperkalemia due to what? Inadequate dialysis? The nurse should administer calcium gluconate and monitor them, or this is an infection process? What do you think? This is classic dialysis condition that happens. This is what we call what? This is hypovolemia due to excessive fluid. So the nurse needs to slow down, and this can happen. You can have disequilibrium syndrome associated with that. And that's your answer choices. This is what we call hypovolemia due to fluid. Air embolism, they're going to have airway issue. Hyperkalemia, they're going to be EKG changes. So these are very, very important. 62. A client with chronic kidney disease has a potassium level of 6. Which of the following should the nurse suspect? Bradycardia, tall peak T wave on an EKG, decreased urine output, and what? Hypertension. If that potassium is 6.0, what should you expect? And then, if you assess me, you're not going to be bradycardia, you're going to be tachycardia, arrhythmia, and you're going to have peak T wave. You try to increase your urine output to what? Get rid of the fluid. And this is educating a group of clients on ways to prevent spread of infection. Which of the following practices should be included? How do you prevent infection? Perform hand hygiene frequently, avoid touching your face, use antibiotic for viral infection, dispose of tissue in a seal bag, and what? And wear gloves when preparing food. What is the best way to prevent infection? That's all. Of course, hand hygiene is the best thing to prevent it. And then don't touch your face. Antibiotic does not prevent infection for viral. Viral, you don't need antibiotic. And dispose your tissue in a seal bag. Wear gloves when preparing food. You shouldn't wear gloves when you're preparing food. 64. At which age should the child receive the first MMR vaccine? You have to know the schedule of vaccination. And this is very, very important. There's a mnemonic you can use to answer. Check out that thing because you have a vaccination video that will help you master this. Now, what do you think? What is the time to give a baby MMR? What do you think? They have to be more than a year. Therefore, at birth, 6 months and 4 to 6 weeks is not indicated. If you know it's more than 1 year, this is the key. And the last question, 85 question, is 65, but based on the 6 next generation cases we did, all of them add to 85. How is your score? How are you doing? Thank you for getting to the end. But this is the last question. The client recovery in message ward after hemorrhage surgery. Which of the following order should the nurse suspect? Hemorrhage surgery is your perineum. If your perineum is burning, what are you going to do to help with the pain? Tepid water, sit bath, bed bath, shower, of course, sit bath. This help relax the muscle and help with that. Thank you very much. Now you have 85 English practice question. It's like a full Q bank for you. I know you're going to pass your NCLEX if you watch all of them. If you take your time, you go through them, answer them, pay attention to the keyword and the answers and explanation. Good luck. Thank you for watching. And if you need more, subscribe to Adapt NCLEX for more content like that. If you need more content, you can join our membership. Take care of yourself and good luck.